And here is your stem. Children are so much noisy behind someone.
Yes.
8, 7 seconds, 6 seconds left.
Okay.
Okay, so if you've read and understood, considering it history-taking station, please begin.
Yes, hello.
Hello.
I'm Dr. Bashir, one of the surgical doctor here. Can I confirm your name and age, please?
Yes, my name is James, and I'm 20 years old.
Okay, nice to meet you, James. Is that okay to call you Mr. James?
Yeah, no problem.
Okay, today I have been asked to ask you some questions regarding your condition. Is that okay with you?
Yeah, go ahead.
Okay. How can I help you today, Mr. James?
Yes, doctor, I have these conditions, diarrhea for the long times, and also I have abdominal pain, and also sometimes bleeding coming from my back position.
I see that must be difficult for you, Mr. James. Could you please describe the area for me?
Yes, doctor, this is a watery diarrhea.
Okay.
Okay.
And when did it start?
Yeah, this is 6 weeks ago.
Did it start sudden or gradually?
It is gradually.
Okay. Does it present all the time or just come and go?
Come and go.
Is it getting worse?
No.
Okay, that's good. And how many times do you experience this area per day?
From that times, eight time.
8 times from that time. Okay.
Yes.
And what is the color of the stool?
Yeah, sometimes watery and sometimes there is a blood.
Okay. Is it painful?
Yes, I have tummy pain.
Yes, I see that. So let me to explain the area first, and we'll go for the tummy pain. Okay.
Okay.
Could you please is that the area is easy flushed or not?
It is flush.
Okay. Is it contain any blood clots or any like mucus?
Yeah, there's some mucus.
Okay. So you tell me that you have tummy pain. When did it start?
Also 6 weeks ago,
6 weeks. Okay. This starts suddenly or gradually.
gradually also.
Okay. It's present all the time or just come and go?
Yes, come and go.
Come and go. Does it move anywhere or?
No. It's all
Okay.
in my tummy.
Could you please describe that tummy pain for me?
Yes, it is dull, doctor.
Well, okay. Is there anything make it better or make it worse, like open your bowel or something?
No.
Okay. If you had to rate that pain from 1 to 10, 10 being the worst, how would you rate it?
It is 6, doctor.
6. Okay. Yeah. I'm really sorry for that. Would you like me to give you a painkiller?
No need.
Okay. And do you notice any intentional weight loss?
Yes, I lost 10 pounds over 6 weeks.
Okay, and do you notice any experience like red eyes, painful eyes?
Yes, yes.
Okay, did you start do you have any joint pain or back pain?
No, no, no.
Any skin changing color or itching?
No, no, doctor.
Okay, do you have fever?
No.
Any changing bowel habits, like constipation, for be specific?
Yes, yes. There is alternative constipation and diarrhea.
Okay, do you experience any stress situation in your life?
No, no, no.
Any tummy bloating?
No, no, no.
Okay, that is good. And do you sudden urge to go to the bathroom stool, but at little amount?
No, no.
Have you recently? Have you traveled recently?
No, no, no.
Okay. And do you have any trauma to your tummy?
No, doctor.
Okay. Do you have any other medical problems?
No, no, no.
Any history of hospitalization
No, doctor.
or surgical operation?
No, no, no.
Do you take any regular medication?
No, doctor.
Do you have any allergy from any medication?
No, no, no.
If there is anyone of your family had a similar condition or bowel problems running in your family?
No, no, no.
Okay, may I ask you some
Yeah.
personal question, please?
Good. Can you please summarize your history now?
Yes, I took history from Mr. James, is 20 years old, presented with the watery diarrhea for 8 weeks, and that not easy flushed with the also associated with the 8 time or 6 times, sorry, and associated with weight loss. And also patient have experienced dull aching to abdominal pain for 6 months, 6 weeks,
Yes.
And also I have experienced a red painful eyes, conjunctivitis, with no signs of fever, and loss of 10 pounds
Pound. Yes.
over 6 weeks also.
Yes.
So I have to consider my main differential diagnosis. My main diagnosis is the inflammatory bowel disease. And also I
Okay.
have to consider that irritable bowel syndrome and
Yes.
chronic cancer
Yes.
and infective colitis
Good.
and diverticular disease.
Okay. How do you plan to manage this patient? What investigations would you ask for?
Okay, after a complete history, what I missed, I do social history, an
Yes.
idea of and concern and expectation, and systemic review. I will go for a full clinical examination. I will give check the full blood count, ESR, and C-reactive protein. I will go for colonoscopy
Yes.
after acute attack, and also inflammatory markers and serological tests, stool analysis.
Yes. What treatment can be offered to this lady?
Yes, as my main diagnosis is the inflammatory bowel disease, I will go for conservative management, dietary control, and also medical management. After discuss with the gastroenterologist, I will give the patient immune suppressant, immunomediators, steroids, and 5-amino salicylic acid.
Okay.
And
Good.
if the patient develop complication, I will go for surgery.
Yes, depending upon the type of complication. Okay, good.
Yes.
Thank you.
Okay, thank you.
Good.